Hello everyone and welcome to the Affinity EHR Ocular Exam Room Efficiencies series. I'm Dr. Justin Manning, one of Affinity's EHR training doctors, as well as the lead doctor educator for Affinity EHR at the education conferences. Today, we're going to be focusing on using protocols to improve our efficiency in the ocular exam room, and we're going to be focusing on a comprehensive exam with cataracts, as well as documenting a follow-up visit for those cataracts. So we start here in the overview screen for our patient, and I've built a lot of our exam in already so we can focus our time primarily in the ocular exam room. However, I do have a chief complaint of blurred vision as well as a change in the patient's glasses prescription, but the vision does not improve beyond 20/25 in both eyes. We're setting ourselves up for a diagnosis of cataracts, but beyond those cataracts, we're not going to do surgery anytime soon, but we may want to schedule that patient back. That's our goal for documenting in this visit. So from here in the overview screen, we're going to tap on the eyeball, the exam here in our menu bar. And again, as I've mentioned a number of times now, the reason that we do that is we're using our protocols. We don't want to be prompted automatically to choose an exam set. So here I am in the ocular exam room, and what I'm going to do next is tap on More. And after I tap on More, I'm going to find those circular arrows with protocols, and I'm going to tap on Protocols there. And as I've done on all of our training sessions so far, I'm going to select my dilated eye exam protocol, and the other protocol that I'm going to use is my nuclear cataracts. And I'm going to turn that protocol on here. And I'm going to tap Save. Now that I've tapped Save, I'm going to go to my Quick Impression Edit and see what we've documented. Now, what I have so far, what's been brought over in my protocol, is nuclear cataracts in both eyes, as well as counseling for those cataracts. And what we've decided to do for this patient, because they're still 20/25 best corrected, is we're going to observe, and we're not going to refer that patient out for surgery. However, that being said, I want to see the patient back in 6 months for a dilated fundus exam. And the other piece is that our notes or our findings that are going to backfill into our exam record is that I had brought over 1+ nuclear sclerosis in the right lens and the left lens. And I will show you that here. First tapping Close and going to Progress Notes here at the bottom. I'm going to scroll down, and what we'll see here is 1+ nuclear sclerosis in the right and the left lens. I'm going to hide that progress note because let's say our patient did not have 1+ NS in both eyes, but rather had 1+ NS in the right eye and 2+ NS in the left. I'd go back to my Quick Impression Edit. And first what I'm going to tap on is Findings. I'm going to tap Findings here. And when I tap Findings, I'm going to get rid of our nuclear sclerosis in the left lens. And I'll hit Done. Because what I need to do now is go back to Quick Impression Edit, and I'm going to resume my diagnosis. And under Findings, I'm going to tap 2+ nuclear sclerosis, and then tap the left eye. And now just to confirm what we have documented, I'm going to tap on Progress Notes, and now we've made the change from 1+ NS in the left eye to 2+ NS. Our plan in counseling and 6-month follow-up is still the same, but again, I brought over 1+ NS as a finding. But in the case that the patient didn't have 1+ NS in both eyes, and the left eye in this case had 2+ NS, I have a very easy ability to remove the 1+ NS in the left lens and then go back in by resuming diagnosis to make the change. From there, I have completed my cataract documentation. I can save my visit note. Now that I'm back in our overview screen, I have my 92014. I did do a refraction in this case. However, for the sake of this training session, I did not document any refractive error or put a plan for refraction in to get that 92015. I certainly could do so in my documentation, but I wanted to show just that nuclear cataract protocol. If everything were good, I could send the fees and finalize the visit by tabbing Finalize Visit here. I'm going to go back to the patient screen and start a new visit because I want to show how to do a cataract follow-up. So what we'll do is we'll go into our Chief Complaint HPI review of systems, and instead of adding a chief complaint, I would add follow-ups, and I would go to follow-ups here. I would tap on nuclear cataract, which was done at our last visit, and now the patient is returning for a 6-month follow-up with a dilated fundus exam. And the patient is now going to present for further evaluation and management. And I can add any other modifying factors in here if I wanted to. And what I would make a note of is that there's been no improvement. The quality, we can make a note that it is constant. And essentially we're setting this patient up for worsening signs and symptoms. So now the patient reports further blurred vision. And again, I don't have to document all of these, but if I wanted to, I could. Now I will go from here and hit save, and then mark my custom review of systems here. And I can save my review of systems. Now I'm going to move back into my ocular exam room, but before I do that, the premise for these trainings have been in using protocols to show efficient documentation. However, I found, especially in this case where I'm going to refer the patient out for cataract surgery, is I'm not going to use a protocol for this documentation, but instead I'm going to import the previous findings from that last visit. I'm still going to start open my ocular exam by tapping on the eyeball here. And then instead of going to more and selecting a protocol, I'm actually going to go to exam here. And this third option I'm going to select is view import previous. And I'm going to go back to my cataract documentation from the last visit, and I want to pull in that entire documented dilated exam. And I'm going to pull in my nuclear cataracts. I'm also going to counsel the patient, and I am going to follow up for the next visit cataract, but I'm going to make some subtle changes there. So I'm going to go ahead and apply all of those points. And when I do that, I get nuclear sclerosis that automatically pops up. In this case, our patient has noted that their vision is getting worse, and our findings do need to reflect that. Here we have 2+ and 1+ from our last visit. What I need to do is get rid of those findings, so I'll tap on findings here, and I'm going to delete both the right and left lens findings. I'm going to hit done, go back to quick impression edit, resume the diagnosis, and let's say now the patient has 3+ NS in the right and the left eye. I'll go back to my quick impression edit because I need to change my plan for the counseling. So I resume counseling, and I go to my surgical options here at the bottom because I did counsel the patient on cataract surgery. And I'll go to my decision at the bottom as well. Tapping on that, now we're going to refer the patient out for cataract surgery for both eyes. From there, I'll hit done. I'll go back to my quick impression edit, and we'll see now that I've included the cataract surgery counseling as well as the cataract surgery in both eyes. But I made a mistake. I'm going to resume that counseling because I forgot to take off the observation portion of our documentation. So I'll uncheck the observation there and then hit done. I'll go back to my quick impression edit one more time and change my follow-up for next visit. Now I'm going to put an estimated date of 1 month, and in this case the reason that I'm going to see the patient back is for a 1-day cataract post-op. So I'll select that as my reason for follow-up. I'll tap done, and then the last piece that I need to do is add one more plan, and that is to refer the patient out for cataract surgery. I hit resume diagnosis, and under plans I find referral. I will tap on the referral plan, and then I'm going to select the physician to whom I'm referring the patient. So we'll send the patient to Dr. Walker here, and I'll hit queue fax. Now, queuing the fax does not automatically send the letter to the provider. If for your MIPS you are reporting on closing the referral loop, by using the referral plan here, I just got my denominator. In order to get my numerator, I need to send this patient's CCD or continuity of care document to the provider's direct mail or HISP email. If I'm not reporting on MIPS, I did just log that fax into document management on the browser, but I do not need to send it from there. I can just go to More, hit Auto Letter, and I'll find Dr. Walker in here. And under Template, I'm going to send my cataract referral. I can attach my HIPAA cover sheet, and I can fax the referral directly to him. I do also want to make it very clear. The referral plan is good because it documents in the chart that you are referring the patient out for surgery. However, I still recommend, even if you are using the referral plan as part of your MIPS, to send an auto letter, because it means you don't have to go back in to the document management to fax from the browser. You still need to direct mail the CCD to the provider in order to get the numerator, but I always recommend using the auto letters as we just did here. So now that we've referred the patient out, I can hit close and I can save my visit notes because I am done. And again, if I had documented the vision exam, I'd have more coding or a higher coding here, and I could send the fees or finalize the visit and send both the fees and sign off at the same time. Thank you for your participation today in our Ocular Exam Room Efficiencies series. We've covered a lot so far, and we're only about halfway done. So we look forward to seeing you on future webinars coming up. And again, what we have covered today is a comprehensive eye exam using cataracts as our diagnosis. And we showed using the Import Previous Findings button within the Ocular Exam Room to document a follow-up visit.